Thank you so much for being here on the show again.
It's my pleasure once again.
Yes, of course. Now, tell me about your unique approach to chiropractic.
Well, most people think of, when they go to a chiropractic physician, they think of getting cracked and popped and that type of thing. And very valid and great technique. It's been around for over 100 years. Has done very good things for people, health-wise, pain-wise, all of that. Right. But what we do is we do a different type of technique, and it's based on the work of Dr. B.J. Palmer, and then Dr. John Grostick, and then finally Dr. Roy Sweat. And what it is up in the upper part of the neck. And what we actually do is we utilize a very specific instrument to be able to adjust the spine. And what we're doing is we're actually just contacting the upper part of the spine, a bone called the atlas. It's right below the skull. In fact, on this model, it's right here. This is the base of the skull. This is the atlas. Mm-hmm. And what we find is that we can take very specific x-rays. We draw some engineering lines on these x-rays and determine the best way to move the atlas with a very light force. And we're talking about a bone that weighs 2 ounces, and we're using probably somewhere in the vicinity of 3 or 4 ounces by the time it gets to the bone. But because we're being so specific with the instrument and adjusting it with that light force, we can use a real light force and get it back into place. Then we can take some x-rays following that first adjustment, and really only following the first adjustment. We don't do it every time or anything like that. But we take the x-rays following that first adjustment that allow us to determine if we got the atlas and the cervical spine, which is this model right here, in the correct position.
Now, what exactly are the benefits that the patient sees?
Great. That's a fantastic question. And really, the best thing about our type of chiropractic with the Atlas orthogonal technique is the fact that we cater to cowards. You've seen the dentist cards, and they say, we cater to cowards, we cater to people that are afraid. There's a lot of people that, frankly, just can't relax enough in order to get the older or the traditional type chiropractic care. And so for those people, this technique will allow them to get adjusted with very little stress, very little tension for them.
Right. Now, if this is right for us, how can we get in touch with you guys?
Real easy. Just call that number that's on the screen or go to our website. We'd be happy to help anybody.
Thank you so much.
My pleasure.